Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine, one of the largest medical schools in the United States. And today our guest is Dr. Vinod Nookala. He's also Associate Professor of Medicine and also Associate CMO, one of the large health systems in the United States. And we've been doing a lot of discussions about the journals. Today we're going to look at another journal, and the name of the journal is, JAMA Oncology, and the name of the paper, that's what I'm trying to say. Glucagon-like peptide 1 receptor agonist and 13 obesity-associated cancer in patients with the type 2 diabetes, and that's the paper we're going to look at it. Just, initially we're just going to talk about how, what are the, what is the paper about, just go through some of the facts in this paper. Okay, so now when we talk about cancer, everybody gets scared. Every year you hear cancer rates are increasing. Nobody knows, is it related to smoking, environment? Nobody knows it. But only thing we know, people get scared. If you ask somebody, what do they know? Anytime you hear the word like cancer, nobody wanted to die from cancer. Okay, now, so when we talk about this glucagon-like peptide 1 receptor agonist, the main thing we're talking about Ozempic and Wegovy. Huge demand. Everybody wanted to lose weight. Everyone is talking about this weight loss drug like Ozempic, right? So, the question today is, this glucagon-like peptide 1 receptor agonist, does it have any effect on this 13 obesity-related cancer? Okay, that is the hypothesis. When you look at the hypothesis, pretty much, the effect and do they control for all this kind of thing? Okay, now let's start. So the paper is published in JAMA network, and the paper, the name is glucagon-like peptide 1 receptor agonist and 13 obesity-associated cancer in patients with the type 2 diabetes, right? And let's recognize the authors first. The primary author, Lindsay Wang, and you have the senior author, Dr. Berger. Okay, let's recognize the study. Now, if you look at this study, how many people are there? There's around 174,000 patients altogether, and then kind of what they decided to put them into 2 groups, and each group have their exposure to insulin and metformin, and then in the one of the group they looked at GLP-1 receptor agonist, and the other group they compared with the metformin, they compared with insulin, and they looked at the relationship with the 13 obesity-related cancer and see. This paper, where did they get the data? It's like a retrospective. There's this data set they used. The name is TriNetX platform. Have a large number of health records from 64 health care organization, 50 states they're covering. So huge amount of data about this TriNetX platform. That's what they used. It's a retrospective study, and they collected all this based on the ICD codes. What they did is the statistical method they used in the study is very significant. They used this propensity scoring to match the cases and the controls. It's a very good because when you have a difference in when you look at propensity score, let's say if I have 1,000 patients and in the cases I have 750, control only 250, I want to match both of them, so increase the weight when I do the analysis, okay? Otherwise, there's going to be the analysis is going to be messed up. So we had to give a lot of credit to the people who did this study. I liked the way they did the propensity score. Now, what did they find? Excuse me, what they found out in this study, that there's 10 out of 13 cancers are decreased when we take this GLP-1 receptor agonist. It's going to be like, awesome big, or at least in this study they didn't mention what type of brand name they take it. So results, what did they find? They compared the the GLP-1 receptor agonist, and they compared with the metformin and the insulin. And when they looked at with the insulin, they found 10 out of 13, the cancer rate has gone down. This is again, this 13 obesity-related cancer, 10 out of 13, the cancer rate has come down, okay? And if you look at this confidence interval, in this study, look at the confidence interval. I'm really impressed with the colorectal cancer decrease, because the confidence interval is like 0.46 to 0.64. That means you got at least a narrow confidence interval. So one thing I would clearly say, there's a big difference of the colorectal cancer when you take GLP-1 receptor agonist. Okay. Now, previously it has shown that GLP-1 receptor agonists are associated with the thyroid cancer. And in this study, when they did the analysis, they did not find that. That's reassuring. That's very good. Otherwise, people were, the increased use of this GLP-1 is going crazy, like everyone knows Ozempic is. Again, they did not find any relationship with the thyroid cancer. That's a great thing. Okay. Now, results from association for GLP-1 receptor agonists with the insulin in patient with the type 2 diabetes. It's kind of, in this picture, you can see where all this relationship with the cancer, and again, I look at the narrow confidence interval and see, look at the colorectal cancer, how narrow it is, compared to the other thing. And then you look at the gallbladder cancer, you got the wide variation in the high confidence interval. So the narrow confidence interval is always good. So again, colorectal cancer is kind of striking. Okay. Again, they put this Kaplan-Meier curve right here, kind of looking at the reduction, the colorectal cancer and the liver cancer striking. Okay. Now, so when we look at, in the study, when you look at it compared with the metformin, GLP-1 receptor agonist, not associated with the lower risk of colorectal cancer, gallbladder cancer, and meningioma. Instead of it was associated with the increased risk of kidney cancer. Okay, so again, there is an increased risk of kidney cancer. I don't know why it is, but that is kind of a little bit concerning. Okay, now let's bring in our chief guest, Dr. Nookala. He's also known as Mr. Negativity. So he's going to talk about the weakness and the limitations of the study. All right, Mr. Negativity.
Thank you so much for inviting me again, Dr. Cheriyath.
Yeah.
So this is a very good study. It was very nicely, you explained it very detailed, and we used the propensity study. And one of the things you have to keep in mind when you look at the big data, 1.6 million patients, any small effect, you will see like it will be a positive statistical significance. So you have to be a little careful. And if there is a big data, there are a lot of confounding factors. And are you trying to say that with GLP-1 receptor agonists, you will be having weight loss and there will be decreased cancer which are related to obesity? It makes sense. Also look at relative risk and absolute risk. There is a difference, and here they were looking at relative risk. You have to look at absolute risk. And look at the hazard ratio. Hazard ratio is less than 1. That means the hazard in GLP-1 group is less than the other group. For example, hazard ratio is 0.3. It means the hazard in GLP-1 group is there is 70% reduction in cancer when compared to the other group. So overall, this is a good study, but again, this is a retrospective analysis with a large data, so you have to be a little careful. And also there is increased risk of kidney cancer. So other studies needs to be done, randomized control studies. But anyways, it's a good study. Thank you so much.
Dr. Nookala don't like this large number of patients. And somehow I'm a big fan when it comes to large number of, when there's an effect. It's like 2 million people, and the effect, I think, kind of tell us much more about the effect. That's my personal opinion, and I do support large numbers, and anytime I see an effect in the large number of studies, I mean a large number of patients, I get concerned about it, okay? And they picked the 13 obesity-related cancer, and give a lot of credit to these people. Large database, when you have large database analysis, they take their effort, they did this propensity score to match, and we like to congratulate those authors for doing the statistically matching both the
So are
cases
you trying
and
to
control.
say
Mhm.
you're matching, if there is a missing data, you're artificially putting some control group, and that might again affect the real data.
Yeah, I'm not debating. I think, again, it could be a strength and it could be a weakness also. But we have to use in today's world the statistical tools to address the missing number of data, right? Like a lot of, anytime I do, Dr. Nookala, when I do studies and all that, you have done studies and you have found some missing data. Like some of them, maybe they might have the weight, but all the other data is available. That doesn't mean you cannot throw all these people out, right?
Understood.
So let's look at it. Again, the funding also in this study, they did not go and beg these people who's making the glucagon like peptide receptor agonist and Ozempic and Wegovy, hey, give me some money. But the others are gentlemen. They looked at, this money is not coming from any of the drug companies. If I'm probably some of this greedy investigator, they could have easily gone to this companies and asked 50 million to do the study. But the study funding is come from some cancer societies, no pharmaceutical companies. And so it's overall, I'm very impressed with the study. The colorectal cancer kind of striking. So definitely colorectal cancer, more studies. Again, in today's world, you need randomized control studies. More studies need to be done. But please read these great studies, okay? A lot of credit for JAMA to bringing this up. You will see about this glucagon like peptide receptor 1 agonist. That's again is going to be #1 drug in the world pretty soon. Thank you so much, Dr. Nookala, for joining us. We will be back with another journal article. So if you have any comments, let's have a discussion, two-way discussion. Put it under the discussion after our video, and then we'll reply to you. At least we can learn from it. Thank you so much for watching. Please subscribe to our channel. Greatly appreciated. God bless.
Don't forget to subscribe.